Hi all, so this is just a quick video to demonstrate the contents and the setup for the new Contiplex 2E Ultra nerve sheath catheter, which is the NRFIT version. So first of all, you've got your 2E needle, which has the usual sort of markings. This usually comes with the nerve stimulator, which I've removed for this demonstration. You've got your catheter with your green introducer. You've got your filter, your catheter clamp, your NRFIT syringe primed with saline, and you also then have your giving set with your white connector. So this is all done and prepared aseptically and inserted, ideally with 2 scrubbed operators. But I'll just show you how to set it up quickly. So first of all, you need to prime your set. So you take the end of your catheter, insert the clamp until the black line and click it in position. I then usually also prime the filter at the same time. You take your syringe and flush it until you see the fluid emerge. You then disconnect your syringe and, using a levering technique, release the clamp to allow you to remove the primed set. You then take your needle and the white connector and you connect that to connect that together. You then take the green introducer here, which pops into the back of the white connector and it clicks into position. You then take the patient end of the catheter and introduce that into the green introducer, which passes the catheter through the needle. And you advance that until you see it emerge and then retract it so that it sits within the shaft of the needle. You then, next important step is to disconnect the introducer. This stops any fluid leaking back and allows all the fluid to pass directly through the tip of the needle. You need to ensure now that you connect your syringe and ensure that you prime the entire giving set and needle. Perfect, so that's the first part of setup. Next, I'm going to demonstrate how you advance the catheter once you're in position. So in this demonstration, I have the ultrasound in my left hand and I'm holding the needle with my right hand, and we're in the right position. And the first technique, there's 2 techniques. So the first one is the 2-person technique. So once we're in this position, I simply hold my position, ensure that I can see the needle tip clearly, and I get a second operator then advance the catheter so that you see the catheter emerging from the needle tip under direct vision. The second and more advanced technique is the single-person technique. So to do this, you need to use your ring and your middle finger to support the device in position, and then utilising your thumb and your index finger, you then advance the catheter using the ultrasound to again visualize your catheter emerging from the tip. So just to demonstrate that a bit closer, you are supporting the device with your middle and your ring finger, and you're using your thumb and your index finger to advance the catheter.